Every year, hundreds of thousands of women around the world choose the Brazilian butt lift, dreaming of curves they've always wanted.
And most of them are never told the full story.
I'm Dr. Sarah Chen, and today I want to have an honest conversation with you. Not to scare you, but because you deserve to make this decision with complete information. Because the BBL is the only elective cosmetic procedure with a mortality rate that once alarmed the entire surgical community. Let's talk about why and what has changed. The Brazilian butt lift, or BBL, involves taking fat from one part of your body, usually the abdomen or thighs, through liposuction, and then re-injecting that fat into the buttocks to create volume and shape. It sounds elegant, even natural. Your own fat, no foreign implants, and the results can look beautiful. But here's what most clinics don't put on their Instagram feed. Between 2010 and 2017, surgeons and researchers started noticing something alarming. Patients were dying, not from infection, not from complications weeks later, but on the table or within hours of surgery. The cause was fat embolism. When fat is injected too deeply, into or near the gluteal muscles, it can enter large blood vessels. From there, fat particles travel to the lungs or heart. The result can be fatal within minutes. In 2017, a landmark study published in the Aesthetic Surgery Journal analyzed data from the International Society of Aesthetic Plastic Surgery. Their finding was striking. The mortality rate for BBL was estimated at approximately 1 in 3,000 procedures. To put that in perspective, that's roughly 20 times higher than the mortality rate for other common cosmetic surgeries. I want you to let that number sit for a moment, not to frighten you, but because you have the right to know it. Now I want to address something I hear constantly, from patients, from social media, even from some practitioners. The myth goes like this: it's just fat, it's natural, it's your own body. How dangerous can it really be? This feels logical, and I understand why so many women believe it. But here's the medical reality. The danger of the BBL has nothing to do with whether fat is a natural substance. It has everything to do with where that fat is placed inside your body. The gluteal region is rich in large blood vessels. The gluteal veins in particular are wide, thin-walled, and under low pressure. That means fat injected too close to them can be pulled into the bloodstream almost instantly. Once fat enters a blood vessel in sufficient quantity, it travels to the lungs, causing what doctors call a pulmonary fat embolism. This can happen within minutes of injection. There is often no warning, no time to intervene.
So when someone tells you it's natural, it's your own fat, that is true, and it is completely irrelevant to the actual risk.
Here's the part that matters, and the reason this story has a more hopeful chapter. After that 2017 data became public, the surgical community took action. The ISAPS formed an emergency task force. The American Society of Plastic Surgeons issued new safety guidelines. And in 2018, a critical recommendation changed how responsible surgeons perform this procedure. The new standard: fat must be injected only into the subcutaneous layer, the fat tissue just beneath the skin, and never into or near the muscle. To enforce this, many surgeons began using real-time ultrasound guidance during the procedure, allowing them to see exactly where the needle tip is at all times. The results have been significant. A 2021 follow-up analysis published in Plastic and Reconstructive Surgery found that complication rates dropped substantially among surgeons who adopted the subcutaneous-only technique. But, and this is important, not every surgeon has adopted these protocols. Not every country regulates this. And not every clinic that offers a BBL is performing it the same way. This is why who performs your surgery matters more with BBL than almost any other cosmetic procedure.
So if you are considering a BBL, or if someone you love is, here is what I want you to walk away with today.
First, only consult with a board-certified plastic surgeon, not a cosmetic surgeon, not a general practitioner offering aesthetic procedures.
a board-certified plastic surgeon certified by the American Board of Plastic Surgery. You can verify this for free at abps.org. Second, ask one specific question in your consultation. Ask, will you be injecting fat exclusively into the subcutaneous layer? And will you use ultrasound guidance? A surgeon who practices current safety standards will answer clearly. Hesitation is information. Third, be very careful with medical tourism for this procedure specifically. The BBL is one of the most commonly performed surgeries abroad, and the 2018 safety protocols are not universally followed. Price should never be your primary filter for a surgery with this risk profile. Fourth, make sure your surgeon discusses your specific anatomy with you. Your body mass, the volume of fat being transferred, and your vascular anatomy all play a role. A good surgeon tailors the approach to you. And fifth, take your time. There is no surgical emergency here. A few weeks of additional research and a second opinion could be the most important investment you make in yourself. I want to be clear about something before we finish. This video is not telling you not to have a BBL. Thousands of women have this surgery every year with beautiful, safe results, performed by skilled, properly trained surgeons following current protocols. What this video is saying is, you deserve to go into that operating room knowing exactly what you are choosing, with your eyes open, with the right questions answered. That is what informed consent actually looks like. Now, I want to leave you with one more thing, because I think it matters. The women who tend to have the best outcomes from BBL are not necessarily the ones who spent the most money. They are the ones who spent the most time. Time researching their surgeon, time asking difficult questions, time being willing to walk away from a consultation that didn't feel right, even if the price was attractive, even if the clinic looked beautiful on Instagram. According to the American Society of Plastic Surgeons, the single strongest predictor of patient satisfaction after cosmetic surgery is not the procedure itself, it is the quality of the pre-operative consultation. Whether the surgeon listened, whether expectations were honest, whether the patient felt truly informed. So if you take one thing from today, slow down. The curves will still be there in 6 months. The right surgeon will still be available. There is no version of this decision that benefits from being rushed. And if you are currently recovering from a BBL, or if you had one years ago and something doesn't feel right, please don't wait. Talk to a board-certified physician. Not a clinic that performed your surgery, not a forum online. An independent physician who can evaluate you without a conflict of interest. Your body is always worth that conversation. If you found this helpful, share it with someone who might be considering this procedure. It could make a real difference. Next week, we are talking about breast implants, specifically what the FDA recalled in 2019, what BIA-ALCL actually means, and what every woman with implants needs to know right now. That video may surprise you. I'm Dr. Sarah Chen for The Aesthetic Truth. Take care of yourself.